right, it is 6:30, so I want the meeting to please come to order. We welcome you to the Metro Council. Today is Tuesday, March 17th, 2020. Happy St. Patrick's Day. Will all members of the council, as well as the public, please rise for the invocation, remain standing for the Pledge of Allegiance. Invocation this evening will be offered by Pastor Judy Hoffman of East End United Methodist Church. She is a guest of Councilmember Brett Withers, and I believe your church was
Don't
harmed.
start that.
Okay. All right, you're recognized.
Thank you. When Councilman Brett Withers offered the invitation to me for the invocation tonight, he had no idea that our city would be ravaged by an F3 tornado, and then followed by this threatening, death-dealing virus. And when I agreed to be here with you, I had no idea that the 125-year-old church that I serve, the parsonage that I live in, or the bed that I was asleep in would be in the path of the storm. So perhaps, Brett, it was fortuitous, or prophetic, or merely a coincidence. But however you think of it, I think of this invitation as a gift. Because to pray for you, the leaders of Metropolitan government, as praying for the citizens of Nashville tonight, in this time of social isolation, it is a profound privilege. So I want to begin with a poem that was written by Steve Garnis Holmes for those who cannot be physically present by personal decision or public decree and are participating online perhaps. And then I'll conclude with a prayer of my own for all of us. Our social distancing is an illusion. We are one. There is no distance, no gap. Isolated in your apartment, you belong. You breathe and it fills my lungs. You weep and my heart is broken. We are one body in many places. So in this time of separation, we open our hearts and we allow ourselves to flow out from our bodies in spirit to one another, to the strangers who are a part of us. And like the Italians singing from their balconies with neighbors, we are all notes of the same song. Love flows where germs cannot. Meditate on our amazing unity. Extend your spirit to include all it includes, the whole world. Breathe in this breath. And breathe out this breath. Let compassion for all beings flow with it, in and out, refreshing your whole body, the whole human family, the whole creation. Let love be our body. And then let your love take flesh. Make calls and write letters. And when you do, come back out. Don't stop being one another's body. It is your life. Let us pray. God of many names, we are grateful that you have pitched your tent with us in our city, where so many are suffering this night. And we're grateful for the ways that you've already made your presence known through first responders and rescue personnel and firefighters and police officers, medical staffs and school administrators. We're grateful for the ways that you keep company with us through friends and family, strangers, even enemies who are on this journey with us. Forgive us, O God, for forgetting how precious life is, for losing sight of your priorities, for failing to adequately serve the poor and the unsheltered, the hungry, the immigrant, and for making health care a privilege instead of a right. So we pray that you would grant us both the strength and the courage that we will need for the days and the months that lie before us. Bless us with a holy boldness to lead with compassion and integrity. Fill us with your sacred wisdom to make critical decisions on behalf of all your people. And remind us once more of your deep desire, indeed your only requirement, that we seek justice and love kindness and walk humbly with you. Amen.
Amen. Thank you. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, you may be seated. Without objection, we will suspend the calling the roll. Ask the clerk to record the names of those members present throughout the meeting. Is there a motion for adoption of the minutes? March 5th, 2020. I heard a motion properly seconded. Without objection, the minutes of the meeting will stand approved as written. Madam Clerk, any messages from the mayor?
No, Mr. Vice Mayor, no messages from the mayor.
All right, thank you. So, ladies and gentlemen, members of the council, we are here tonight under very unique circumstances. When our city is in crisis, we have a responsibility to step up. I appreciate your being here. I appreciate your willingness to follow strict procedures, which include social distancing. For the viewing audience, we take our responsibilities very seriously. We have certain items that are on the agenda tonight that are important for the city's financial well-being, including certain measures to help in tornado recovery. After carefully reviewing all legal, which includes looking at the charter, and other matters, I decided that our best approach was to meet tonight to handle these matters. With very few other exceptions, everything else will be deferred off of our calendar. But in meeting, we took very specific precautions. Council members are spread out all throughout the room. The chamber has been disinfected. We have very limited staff here. Mr. Pat Nolan is not introducing the session, as you can tell. And the public has been asked to watch on Channel 3 or on the web. Even the media has been asked to stay in certain areas. So we want everyone to take all necessary steps to stay well and be safe. And together, we will get through this. Without objection, we will start our meeting by hearing from various health officials in the United Way regarding the current coronavirus situation. We were able to do this via live feed through the health department. Are we ready to proceed? Okay. If you'll watch your monitors.
Good evening. This is Dr. Michael Caldwell. I'd just like to do a sound check with you to see if you can hear me okay.
We can hear you fine. Thank you, Dr. Caldwell.
Thank you. I'm the Nashville Director of Public Health. I'd like to thank you all, including Deputy Mayor Schulman, Mayor Cooper, and the entire council for this opportunity to update you and to speak to the community through the citywide audience. We will discuss momentarily. Public awareness is one of the vital features of our plans to combat the COVID-19. We need your help to reach the constituents in your community, people across the entire city and county, to provide them with information on how they can keep themselves and their families safe, on how to seek assessment, testing, and treatment programming. Collectively, we are going to update you on a range of coordinated activities designed to achieve one guiding priority: to flatten the curve of growth of the virus. Our ability to flatten the curve, to minimize exposure and new cases of coronavirus, is directly related to our ability as a community and a region to return to normal life. The first step of progress is public awareness and getting the public to take seriously a threat that many thought would be contained overseas, and that is now here in Nashville and Davidson County. To all of those partners who are working around the clock, thank you. You are making a difference. We have to continue to work together to help each other. I believe that we have turned a corner and that the community is now taking this threat seriously. And they're taking serious steps with guidance and on their own for preventive measures so that we can defeat this virus. We want to emphasize three things. One, that this is a high-level report on a plan that is underway and adding to the plan on a daily and in fact hourly basis involving growing number of local, state, and federal partners. We can share with you tonight the actions underway and plans for others that you will see in the short term. Number two, our plan will continue to evolve with what we learn going forward. This is a highly challenging and complex matter that we are working to address in a rapidly evolving environment that is informed with fresh data and science. Please be patient with us. Number three, we will continue to communicate with you and the public regularly. I'd like to update you on the latest numbers that were released earlier today from Davidson County. We now have a total of 46 confirmed cases. That's a new number of cases confirmed in the last 24 hours of 21. We all know what to do, and I see a lot of people doing it. What we've requested to be done, people are even taking more aggressive action. People are distancing themselves, washing their hands often, using a hand-based sanitizer if soap and water is not available, and following all of the other precautions. Staying home if you're sick, making sure, especially if you're in the more vulnerable categories, that we're taking extra special care to make sure that they are not in contact with anyone who may be sick, or for that matter, anyone that is not needed for them to be around. In addition to updating you on the latest numbers, I'd like to take a moment to let you know about what's happening with the enforcement action that the Board of Health took a couple of days ago to declare a public health emergency in Nashville and Davidson County. This public health emergency is now resulted in my signing just a few moments ago an order from myself as the Chief Medical Director to be issued in person to every of the 4,500 permitted facilities that we have throughout Davidson County. We are also amplifying this message on our website as well as through email. This order provides the direct information to the businesses on what we are ordering them to do. I can tell you from my field visits over the past 2 days, including in the last few hours, I have seen tremendous voluntary compliance, going even beyond the steps outlined here in the order. And if we are made aware of any facilities that are not in compliance, we are doing our best to respond to those promptly. But in addition, we're being proactive and working with our environmental health inspectors, as well as those that I will be deputizing, to do a survey and inspection throughout the community to assure that we can answer any questions people may have and to identify the great voluntary cooperation that we're seeing with this order. I would like you also to know that we are keeping our Metro employees informed. We've worked with the Department of Human Resources and providing them guidance, which is going out to all the department heads and through them, their employees. And we are specifically looking to provide additional guidance to those employees who may have special vulnerable characteristics of themselves if they are part of the vulnerable population that we want to be assured that we can do our best to accommodate them in their work environment. In addition, so much of our employees are government public facing, and we are here to continue to serve the public. We're communicating with all people through human resources to make sure that they have the latest guidance, and we're here to answer questions, and we're being very proactive to go out to the departments. We have two additional colleagues who are going to provide some additional updates. One is Dr. Schaffner from Vanderbilt University Medical Center, who will talk to us about the virus and how it spreads. And then once Dr. Schaffner provides his comments, I'll have Dr. Jahangir provide an update regarding the progress we're making with all the work he is doing. Dr. Schaffner, it's my pleasure to turn it over to you, and I'm going to go on mute. So thank you so much again for contributing to our discussion.
Thanks, Michael, and members of the council. It's a privilege to be with you this evening virtually. That's one element of social distancing, isn't it? And I am pleased to provide just a little bit of background. You all know that a few months ago, a coronavirus that normally lived in animals transferred to a human host, probably in what was called a wet market, a wet seafood and animal market in Wuhan, China. There was one transfer, one species jump of a virus from an animal to a human, and that virus, now multiplied, is moving around the world. It has come to the United States, and it is now spreading here. It's a respiratory virus. When it enters our bodies, it goes to the back of our throats and then down into our chests, into the bronchial tubes. It causes inflammation. That's part of the body's response. And as part of that, we can develop fever, a cough, feeling badly, sore throat, and if this virus leaves the bronchial tubes and goes out into the substance of the lungs, it can cause pneumonia. If it does that, obviously, it interferes with the lungs' capacity to exhale the bad air and bring in the good air. If it's bad enough, people have to be hospitalized. They may need assistance with a ventilator in order to breathe. And some people, if this pneumonia and the general systemic inflammatory response is bad enough, will die. There are a group of people who are most vulnerable, just as Dr. Caldwell says, to the most severe aspects of this illness. They're not more likely to get the virus, but if they acquire the virus, they're more likely to have a serious outcome. This outcome is more serious with advancing age, just as it is with many illnesses. It's also more serious if people have an underlying chronic medical condition. If you have a predisposing heart condition or lung condition, if you have diabetes, or if you're immunocompromised in any way. So we would like to do one of the great goals of our current public health programs across the country are to minimize the occurrence of these serious illnesses that lead to hospitalization and, of course, death. Another goal is to dampen the curve. You've heard that said many times. Epidemics start, peak, and then come down. If nothing is done, that peak can be very high, and all the patients then in that peak will come to medical care more or less simultaneously, which makes it very difficult for the medical care system that we have in our country, all the way from doctors' offices and clinics to emergency rooms and hospitals, to respond appropriately to all those patients. If we can spread out this epidemic, dampen the curve and spread it out, we in medical care will be able to take care of patients much better and more appropriately. Now, this virus gets back into our throats and then is spread very readily. It's very contagious from person to person. If I exhale and I have the virus, you don't see it, it's microscopic, but in what I exhale is the microscopic virus. If then you are close to me, within 3 to 6 feet, you, of course, will inhale, and you might inhale something of what I've exhaled along with my viruses. They then land in the back of your throat and cause an infection. So you can see that the public health intervention that is designed to dampen this curve is designed to minimize the spread of this virus so that I don't give it to you. And the way to do that, obviously, if the virus is spread readily from person to person, is to create more distance between us. The more distance between me with the virus and all of you out there, the less likely it is for my virus to infect you. Hence, social distancing. Everything that's currently being recommended nationally and locally is to increase distance between people. Don't go to large crowded events, for example. There are all kinds of ways that this social distancing is being implemented both in our professional and business lives, as well as in our personal lives. So that's the whole rationale between the social distancing phenomenon. I have been impressed, along with Dr. Caldwell, not only what's happening here in Nashville, but nationally. I frankly am surprised that the American public has largely, not completely, but largely, really gotten with the program. They have lots of questions about how to actually implement this social distancing, but they would largely like to do the right thing, not only to protect themselves, but to create a healthier community. You all are doing that right now. You're spreading yourself out. You're asking the public to tune in virtually rather than in person. And that general principle is being spread out, and we're trying to implement for a substantial period of time. I can't give you that exact duration, but for a substantial period of time so that this epidemic curve can be diminished and spread out, thus lessening the major impact on our population and also relatively sparing people serious illness that requires hospitalization. And obviously, we would like to prevent as many deaths as possible. I thank you all for your attention, and I am sure that you will assist all of us, because we're all in this together, in getting with the program and doing the very best to make and keep Nashville the healthiest, disease-free community that we can possibly make it. I'm happy to help you on this and, of course, on any other occasion. Thank you. You're very kind to give me this, your attention.
Thank you, Dr. Schaffner.
Dr. Schaffner, thank you so much. We really appreciate your continued guidance and expertise. Thank you so much. I'm going to introduce now Dr. Alex Jahangir. He is the chairman of the Board of Health and now serving as the chair of the Nashville COVID Task Force. So Dr. Jahangir, thank you. It's your time.
Sure. Thank you, Dr. Caldwell, Dr. Schaffner, members of the council. I appreciate the opportunity to speak with you all today. I just want, you guys can hear me?
Yeah, we can hear you.
You hear me? Okay. I'm sorry, my camera didn't. All right. Members of the council, again, thank you so much for the opportunity to speak with you tonight to tell you what the Nashville COVID Task Force has done. The mission of the Nashville COVID Task Force is to flatten the curve of the disease and ensure that the people of Nashville and Davidson County are kept informed and safe. Now, our plan to do this involves first, raising awareness, second, the establishment of community assessment centers, and third, a strong cooperation amongst all of our hospitals in our city. Now, first, on raising awareness, what we have done is from the establishment of this task force, we're committed to providing public updates. If you notice, each day you receive a briefing to keep everyone updated on the status of the disease and initiatives that we are undertaking. Secondly, we've established a website. The website will provide information on the disease, but it also will provide information on the status of all Metro and community services. This website will be continually updated, and I'm really excited to announce that it was launched at noon today. The website's address is COVID-19, so COVID, the number 1, the number 9, .nashville.gov. The third thing we're doing to raise awareness is the establishment of a hotline. This hotline is established to provide information to our citizens about the disease. They'll be able to call in, and there'll be several ways to get information. The second function of this hotline will be to establish screening and possibly encourage and direct people for assessment. This hotline will be staffed by health professionals and will be around very soon. The final thing we are doing is establishment of community assessment centers. Now, these centers, which will be anywhere from 6 to 9 and distributed throughout the county, will be an augmentation to the already hearty assessment that is being provided by our local hospital systems as well as our local physicians and clinics. These will be staffed by all 5 healthcare systems and medical schools, and will be done in conjunction with our task force. They will be large in scale and will be a combination of mobile sites as well as some brick and mortar sites throughout our city. Working together with all the hospitals, we also are making sure that resources are used appropriately. Through this task force, I am in regular communication with our ICU physicians as well as our emergency room physicians to ensure that there is not a sudden spike in severity or incidence that may require us to help each other in certain ways. As you all know, this is an ever-changing and challenging situation. We are working as fast as possible, and so we really do need your support and patience, and I will commit to keeping you updated as we move along. Thank you. I would like to now turn it over to Mr. Brian Hassett, who's the President and Chief Executive Officer of the United Way of Greater Nashville. Thank you.
Thank you.
Just start talking and just see if I can do a sound check. Now we will.
Hello, this is a sound check.
We're good.
Okay. Mr. Vice Mayor and members of our City Council, the United Way has been working for the last week or so with key representatives of the Mayor's Office, Mary Falls, and others to develop our charitable and philanthropic community's response to the COVID-19 virus. We have assembled a number of committee members from the religious, business, community health, mental health, and Vanderbilt University to help guide us. The committee is being chaired by Senator Bill Frist, and their first meeting will be tomorrow at 2 p.m. We are initially focusing on the needs of our disrupted workers, particularly in the entertainment, tourism, and the hospitality industry, but we will help all who need help and anyone who is in need because of the virus and its effects. We have been working with the Middle Tennessee Donors Forum, and we are grateful for the support of Butch Sheridan and the Nashville Convention and Tourism Bureau for their initial gift of over $500,000. We launched the fund just about noontime today with the mayor, and we are approaching $1 million today. We will focus on community-based organizations that we know well. We support 100 or so of them throughout the region already. They know how to help people directly. We know this will involve direct support of individuals. We're also getting calls from small business owners. We are worried about them, but our initial focus will be on their employees. We expect that the business community will support this fund generously. On the heels of the tornado, we are working with our friends at the Community Foundation who are doing a great job on the needs of people affected by that. We believe that our ability to partner with faith-based, religious, business, and government, our government colleagues to address these issues will be hopefully successful. We do know it will be a long challenge. I know some of you will have direct questions, and if you have a pen, my direct phone number at my office is 615-780-2432. Please feel free to contact me directly. If you are interested, we do have a website up and running. We have been learning from our colleagues in Seattle and Boston, New York City, and other cities who have had the virus in their communities a little bit longer than us. And we're interested in anyone's good ideas about how to address this. Again, we want to thank Mayor Cooper for his trust in us and in our donor community who we believe will support this effort.
All right. Thank all of you for being on the video. We appreciate all the information and the assistance. Is that it? Okay. Thank you. We are ready to proceed with the rest of our agenda. Whatever information that, if anybody does have questions, if you'll direct them to Mr. Cooper, we can always follow up. I believe there's a hotline that's being established. We need to get that phone number, a couple of other things, but that information was very helpful and very useful. And particularly share the covid19.nashville.gov website. That's important as well. Sounds like community centers are going to be staffed up soon, 6 to 9. We need to get that information to you all as well. All right, and I also thought a couple of things, flatten the curve. I think you've seen that, and we need to get with the program. All right, proceeding ahead, Chairman Rosenberg, you are recognized on emergency rules. Back from your seat at the public table, the podium.
Thank you, Mr. President. I move to adopt Emergency Council Rules of Procedure effective immediately, which will consist of the current 2019 to 2023 Rules of Procedure with the following modifications. By adding the following at the end of Rule 11 related to filing of legislation, which states, while the emergency rules are in effect, physical signatures shall not be required on legislation. By adding the following at the end of Rule 13, also related to filing of legislation, that saying, while the emergency rules are in effect, electronic copies of legislation may be filed in lieu of paper legislation. Legislation may be filed by the council office at the request and on behalf of sponsors by emailing the legislation to the clerk's office. By deleting the second paragraph of Rule 26 related to access to the council chamber and substituting with the following. Only council members, council office staff, and clerk's office staff may be present on the council floor. All other persons, including the press, shall remain in the gallery. By suspending Rule 28 related to public addressing the council. By adding the following at the end of Rule 43 related to deferrals, stating, notwithstanding the foregoing, any ordinance or resolution that is deferred while the emergency rules are in effect shall not be automatically deferred indefinitely upon the third deferral. Thank you.
All right, so Chairman Rosenberg has moved for the adoption of emergency rules, properly seconded. Any discussion on the adoption? Seeing none, all those in favor say aye. Opposed, no. The emergency rules are adopted. So we are now on the calendar. Without objection, we will be deferring all elections and confirmations, and also the resolution on public hearing, one meeting, without objection. All individuals requesting to make public comment, this is public comment day, have been spoken to and were requested to submit their issues and concerns in writing, so we have no public comment. We are now on resolutions, which is on page 2 of your agenda. We are going to be taking up certain resolutions tonight. I'm going to go over those. I'll go over them twice to make sure you can keep up with them. Here they are. Resolution RS 2020-212, 213, 214, 215, 237, 239, 240, 241, and 242. Resolutions 212, 213, 214, 215, 237, 239, 240, 241, and 242. Yeah, Ms. Hancock? Okay, so they have actually, so Councilmember Hancock, since she's not at a microphone, asked about the list that we got from the mayor's office. They added resolution RS 243. Is that the right number? Okay, so that is also going to be added to the list. Thank you for that. All right, anything else? Everything else is going to be deferred. Okay, without objection, every other matter that was not listed here on the resolution calendar is deferred automatically, one meeting. Got it? All right, so we are now on RS 2012, I'm sorry, RS 2020-212 by Council Members Mendez, Welsh, and Suara. This is a resolution reducing the authority of the Metropolitan Government of Nashville and Davidson County to issue general obligation bonds pursuant to certain initial resolutions previously adopted by the Metropolitan County Council. Councilmember Mendez, you're recognized.
Thank you, Mr. Vice Mayor. There was one committee report from Budget and Finance. The committee recommended in favor 11-0. And with that, I would like to move approval with a brief explanation.
Okay, I got a proper motion, proper second, and you're recognized.
All right, this is one of 4 financing motions. This one deauthorizes some prior approved GO bond obligations that are deemed not necessary at this point from bond resolutions 6-7 years ago.
Okay, you've heard the explanation. We have a proper motion, proper second on 2020-212. Any other discussion? Seeing none, all those in favor say aye. Opposed, no. You adopt. Resolution RS 2020-213 by Council Members Mendez, Young, and Welsh. Initial resolution determining to issue general obligation bonds to the Metropolitan Government of Nashville and Davidson County in an aggregate principal amount of not to exceed $154 million. Councilmember Mendez, you're recognized.
Committee report, again, one committee report. Budget and Finance had recommendations on 3 amendments, and then the bill is substituted. The recommendation on the SWOPE amendment was 0 in favor, 11 against, so it was not recommended for approval. For the Toombs amendment, it was 5-5, so also not recommended for approval. And then the Vercher amendment was recommended for approval, 10 in favor, 1 against. The bill or the resolution was recommended for approval as substituted, 10 in favor, 0 against. With that, I'd like to move move in favor of the bill with an explanation.
Okay, so do you want to move the substitute?
Yes, I'll move the substitute with an explanation.
Okay. All right, so I got a motion on the substitute, properly seconded. Back to you for discussion.
All right, so the substitute changed the capital spending plan from $154 million to $180,778,000. The changes were, the increases were all tornado related, and including schools and other emergency purchases as a result of storm damage. In addition to that, I understand that on what I refer to as the Vercher Amendment, which had to do with funding the Murfreesboro Road Police Station for out in Antioch, that there's been a compromise with the administration, and in order to move an amendment to this substitute, I would need to suspend the rules.
All right, so I'm going to ask Mr. Cooper real quick. I think, let's make sure we've got this in the right procedure. So Councilmember Mendez has moved for the substitute, properly seconded. Do we need to take action to get the substitute in front of us before we start?
Yeah, let's go ahead and vote to accept the substitute, and then amendments can be offered.
All right, so procedurally where we are is we have a motion to approve the substitute. We're not approving the whole thing. What we're trying to do is get the substitute in front of us as approved, so we would take up the resolution as substituted. So, any discussion on the substitute? Okay, seeing none, we have a proper motion, proper second. All in favor of the substitute, say aye. Aye. Opposed, no. So the substitute is adopted. We are on now your resolution as substitute.
All right, and
Councilmember Mendez.
Mr. Vice Mayor, I can either ask to suspend the rules, or I can describe what I understand the compromise to be before I do that.
All right, so, yeah, why don't you go ahead and describe it, and then we'll see if there's any objection.
All right. The amendment, if you want to, as it started out in your package, was page 16 and would have added nearly $12 million to the capital spending plan. The compromise is to change the number in the amendment from $11,985,900 down to $1 million, and to specify that it's for planning for construction as opposed to actual construction. And with that, I would move to suspend the rules to bring this amendment.
Okay, so Councilmember Mendez is asking to suspend the rules to get this before this body. So because of the unique nature of this, and because this was just worked out, unless there's an objection, I'm going to go to Councilmember Vercher if you want to explain your amendment, but then we're going to have to discuss whether we can suspend the rules to get it before us. Before we take that suspension vote, I'm going to give you the opportunity to explain your amendment. Okay? You are recognized.
Thank you, Vice Chair. The chair already explained it, so I don't want to belabor the point.
Okay.
As he provided his committee report, Budget and Finance did recommend approval of the initial amendment yesterday that would have added additional funds to the capital spending plan. There's been some changes as it relates to some financial issues between yesterday with the approval and today. And the administration has graciously worked with the Southeast council members, also council members out on the south side of the quadrant, and she's not here also, but Councilwoman Emily Benedict as well too. So this has been definitely a team effort in ensuring that we continue to put at the forefront public safety for one of the fastest growing areas in the city. So thank you, Vice Mayor.
All right, thank you, Councilmember Vercher. So Councilmember Mendez, let me just explain where we are. He has moved to suspend the rules so we can get the amendment in front of us so we can have discussion. Any objection to suspension of the rules? All right, seeing none, Councilmember Mendez, we're on.
So I'm going to move.
Trying to find you where you are. Okay, so we are now, we have suspended the rules so you can take up the amendment.
Right, and I know this unorthodox because we don't have it in writing, so I'm working from what's called Amendment 1 in the amendments package, page 16. There's two places in that amendment where it mentions the $11,985,900. The amendment is to change both of those to 1 million and to specify in paragraph 2 of the amendment that it is for planning purposes only. And with those changes, I would move amendment number 1 that's in the package.
Okay, so there's a proper motion, proper second. Councilmember Glover, you're recognized.
Yeah, I have to ask this question, Mr. Cooper. We're identifying this as Amendment 1, but yesterday Amendment 1 was Councilman Swope's. So I'm just, because we're taking it in a different order, so I'm just asking for clarification, Vice Mayor.
Mr. Cooper.
The amendment will be numbered based on how it's offered here. Okay. So this first amendment being offered will be amendment number 1, which is the revised amendment that was considered in committee yesterday.
Okay, and then, but the others will still be brought up on the floor?
They can still be
Okay, all right.
offered.
Thank you, Vice Mayor.
All right, thank you, Councilmember Glover. Councilmember Swope.
Just one quick question for the sponsor on this. Does this, if we vote to approve this, does this still allow us to get the helicopters that are needed for the MMPD?
Yes.
All right, thank you.
All right. Anybody else in the queue? All right, so we're on the motion to adopt amendment number 1. It was properly seconded. Seeing nobody else, all those in favor say aye. Aye. Opposed, no. I think the amendment is adopted. Okay. Amendment number 1 is adopted. Councilor Mendez, you're back on your bill.
Mr. Vice Mayor, I'm ready to move the bill as substituted, but if I want to give a chance, if anybody wants to move one of the other 2 amendments, they can do so.
So we have 2 other amendments, and I think it's proper that we hear from the other individuals. Councilmember Swope, on your amendment.
Thank you, Your Honor. I would make a motion to move Amendment 2 in your packet, which I think is page 17.
All right, so I got a motion to move amendment number 2, properly seconded. Back to you for discussion.
Thank you, sir. You know, while I understand the city and each of us individually has experienced trying times over the past month, from budget tightening to what I'm now calling the tornado virus, and while I fully appreciate that amending a proposed capital spending plan is not normally something I would even support under any circumstances, I do humbly request you give this some serious consideration. This project is a traffic circle at the intersection of Edmondson Pike, Mount Pisgah, and Banbury Crossing, which is probably one of the worst intersections in my district once you get rid of Nolensville Road and Old Hickory Boulevard. It's been in the capital spending plan for 3.5 years. It was promised me by the last 3 mayors on the condition that the community agreed if a developer was willing to donate the land, which is exactly what happened last fall. So we already own the land for this, so there's no land acquisition costs whatsoever. The subdivision that's being built on that corner is currently being built. So if we leave this intersection with a hard corner and a blind corner coming into this, it's going to be a mess. But much more importantly, 4.5 years ago, former Councilman Fabian Bednay and I beat TDOT up pretty hard, and we got the expansion of Nolensville Road approved. Now, it's taken 3.5 years to buy the right-of-way, but that project will turn Nolensville Road from Old Hickory Boulevard to the Williamson County line to a 5-lane road. It'll start in November, and it's going to take 2.5 years. And I'll tell you exactly what's going to happen. It is going to push over 1,000 cars a day coming from Williamson and Rutherford County across Holt Road and straight up Edmondson. If we don't approve this, and I'm not asking for additional monies on this, this is literally taken and just allocating part of the existing paving budget for Public Works. If this doesn't happen, I do fear that I'm going to have an accident at that intersection every single day starting in November. So with that, I humbly ask your support of this.
All right. Thank you, Councilmember Swope. Councilmember Glover.
So, Mr. Cooper, I'm going to come back to one of the same questions I asked yesterday that I think are extremely relevant. I'm going to support this today, but in the event that it fails, is Councilman Swope able to bring this back once we kind of get a better feel for where we are financially, realizing that we just spent millions of dollars, or we're about to spend millions of dollars with the tornado relief? We have no idea what everything else is going to entail as far as expenditures are concerned. Will he be able to bring this back for a possible relook, maybe even as early as over the summer? And I don't have a timeline necessarily, but I just want to make sure that if it doesn't pass tonight, that we're not closing that window for land he got donated in his district.
Mr. Cooper.
It could be brought back at any time as a resolution. Instead of shifting money, it would be new capital money, but it could be brought back at any time.
Okay. Thank you, Vice Mayor.
All right. Thank you, Councilmember Henderson.
Thank you, Vice Mayor. I rise as chair of the Public Works Committee, respectfully in opposition to this amendment. If you look at the CSP and the Public Works section, traffic management, paving, sidewalk, roadways are all significantly less than what we typically do in a year. And I recognize this is somewhat of a interim or emergency type CSP. It's not a typical one. But respectfully, we all have a need similar to what Councilman Swope is conveying. We all have dangerous intersections that require roundabouts, additional turn lanes, reducing our paving program and bumping this to the front of the line when we, as a body, have worked very diligently over the last term to make sure that our capital spending is much more transparent and objective and ranked and going through a process. And so I absolutely have empathy and appreciate the situation that your district is in, but we're all in a similar boat. And so just, on principle and to process, I would ask colleagues, let's please not do this because it's just, in my view, out of order, and we need to stick with our prioritization related to safety and other reasons, the objective rankings that we have all committed to. Thank you.
All right, thank you, council member. I need to be careful with this new format. Anybody in the back or on the sides have any, if you do, just raise your hand so I'll recognize you or stand up. Councilmember Nash. And you may want to disinfect the microphone when you come up. I won't say what was just said in the rest of the gallery, all right? You're recognized. Oh, here we go.
The district that backs up to Emerson Pike, and having several friends that live out in that Branberry neighborhood, that is a tough intersection. And I was wondering, where and when were the priorities set? I guess is my question. Where was that process?
All right, Councilmember Swope, you're recognized.
Councilman Nash, this was every year, except this year because we haven't done it yet, but every year this body ranks everything in the CIB. This came out as number 2 last year. So I would say the former council body ranked this pretty high in what's necessary to be put into a capital spending plan. Does that answer your question?
Kind of. So, but I kind of got the impression from the Public Works Chair that it wasn't on the list.
So I'm going to go to the Public Works Chair, Councilmember Henderson.
Thank you, Vice Mayor. So colleagues who are new to the body this year, since we've not been through this process, last year, in somewhat of an evolving process, trying to move towards more transparency and objectivity, engaging our planning department and looking at our sidewalks, our roadways, and so forth, and ranking those as to safety metrics, equity metrics, all of these different factors. We also, as a body, as council members, put forward things that we wanted to be in the CIB, and so there was kind of the council ranking. There was department prioritization, and I would say respectfully, I don't think our department prioritization is as transparent as it should be yet, and the planning department, and somewhat of a convergence of those 3 rankings to arrive at a prioritization. So that would, be
a little lower on that list, final list?
Different in any particular year. I cannot speak, Councilman Swope, to specifically the position on if that was the council list or where that
was the council list.
Okay. And so, but that is not the only list. That's the list of our biggest wants, and those are filtered through the Public Works Department and the Planning Department. So for colleagues that are new to the body, that we were kind of giving points to certain things, and council members could confer with other council members to add points to kind of elevate things. So I think that process, frankly, had some flaws. I think we continue to work on it, but again, just respectfully, at this juncture, if we were to allow, with great empathy and respect for the need in the councilman's district, imagine if all 35 of us in this moment wanted to likewise do the same. And so I would just ask us, please, to follow our process and the work that we have been doing to make our capital spending more transparent and objective, and not be amending this capital spending plan at this time in this way. Thank you.
All right, thank you. Councilmember Mendez. Councilmember Mendez has called the previous question. We're on the previous question. All those in favor of the previous question say aye. Aye. Opposed, no. Previous question prevails. So we are on amendment number 2, okay? So we are voting on amendment number 2. This is Councilmember Swope's amendment. We're going to do it by voice vote first to see if we can do it. All those in favor of amendment number 2 say aye. Aye. Opposed, no. No. I believe the noes have it. So amendment number 2 fails. We are now on amendment number 3, which would be Councilmember Toombs. You're recognized at the planning table.
Thank you, Mr. Vice Mayor. So this amendment adds in a relatively small project. It's $300,000, and that would take away from the paving program. It's to make some turning lane improvements at Warmers Arm Road and Whites Creek Pike. And I have, as a new council person, I haven't had the opportunity to participate in the ranking program, but I do know what ranks important to my constituents, and it's my job to advocate for them. There are significant wrecks at that intersection of Whites Creek and Warmers Arm Road. It's a tricky intersection where cars are constantly turning into the ditch. I actually had an opportunity to witness that for myself. Saw a car in the ditch with the airbags deployed. And I've heard about this from my constituents on the campaign trail since I've been in office. It's been in the CIB since fiscal year 2015, and the constituents have been complaining about it way before then. Again, it's a relatively small project, but it would have a big impact on public safety in District 2, and so I ask that you support the amendment.
All right. So the council member has moved for adoption of amendment number 3, properly seconded. Discussion on amendment number 3. Councilmember Murphy, you're recognized.
Thank you, Vice Mayor. I wanted to kind of echo what Council Lady Henderson said previously on the previous amendment. As planning chair, I've been working with the planning department to continue to revise our capital improvements budget and the process that we do that. As I've heard from many of y'all, previous council members, and as Council Lady Henderson mentioned tonight, a point system is extremely biased, arbitrary, and we had the opportunity to horse trade on those points for those rankings. And so I really think that when we're quoting what was the ranking and the priority of the last counselor or previous counselor, what year, we've got to take that into effect. And then also, again, tonight, the purpose of us meeting tonight, under the circumstances that we are under a state of emergency, a city of emergency, we need to move this forward. We need to move the original administrative package forward and get on home to our districts, because we have a lot of emails, we have a lot of people to answer, and we have a lot of work to do. I know that a lot of our districts have work to do with their constituents and making sure that they have power, food, and a roof over their head. And so I think tonight we need to move forward. I'm not going to make a motion to move these amendments to the table, although I'm tempted to do that. I think it is time to get back to business, move forward the original package that focuses on the needs, the immediate needs of our city, and get on with our business. Thank you.
All right. Thank you, council member. I'm looking back in the back just to make sure I'm not missing anybody, or on the sides. All right. So we have other people in the queue. Councilmember Glover, you're recognized.
I'm going to ask Mr. Cooper the same question. Same would apply here. It just would have to come back as a resolution, correct?
Correct.
All right. Thank you, sir.
All right. Thank you, Councilmember Henderson. You're recognized.
Thank you, Vice Mayor. Just rising again as Chair of Public Works, I won't reiterate the case that I was making as to Councilman Swope's amendment, but I do want to express to Council Lady Toombs, we all do appreciate the need and have empathy that is a intersection that is dangerous, but then again, also all 34 of us have an equally dangerous intersection likely. But that said, through objectivity, right? And how many wrecks have we seen? How many cars have gone into ditches and so forth? We can look at that and say, what are the intersections that we need to repair first from a safety perspective? And so, again, colleagues, I would just ask, respectfully, I appreciate the council lady's need and her constituents' need, but we cannot go about amending the CSP in this fashion. Thank you.
All right. Thank you, Councilmember Henderson. Councilmember Van Rees.
Call the question.
Previous question's been called. We're on the previous question. All those in favor of the previous question say aye. Aye. Opposed, no. Previous question prevails. We are now voting on amendment number 3 by Councilmember Toombs. All those in favor say aye. Aye. Opposed, no. No. The noes have it. The motion is defeated. So we are now back on, I don't believe there's any other amendments. We are on Councilmember Mendes. You're recognized.
So I'd like to move the resolution as substituted with Amendment 1 on it.
All right. So you've heard the motion, properly seconded. Any discussion? All right. So we are actually on. This is the vote on the resolution as substituted with the amendment on it. All right. Seeing nobody else in the queue, all those in favor say aye. Aye. Opposed, no. Resolution is adopted. Thank you, Councilor Mendes, and everybody. This was a good discussion. We are now on Resolution RS 2020-214 by Councilmember Mendes. Initial resolution authorizing and providing for the issuance and sale of water and sewer revenue bonds in an aggregate principal amount of not to exceed $500 million to the Metropolitan Government of Nashville and Davidson County. Councilmember Mendes, you're recognized.
This is the third of the 4 financing ones. This had one committee report. The committee, Budget and Finance Committee, recommended approval of Resolution 214, 11 favor, 0 against. With that, I'd move approval.
Okay, got a proper motion, proper second. Any discussion on this one? Seeing none, all those in favor say aye. Aye. Opposed, no. You adopt. Resolution RS 2020-215 by Councilmember Mendes, a resolution supplementing substitute resolution number RS 2010-1442 to authorize the execution terms, issuance, sale, and payment of water and sewer revenue bonds in an aggregate principal amount of not to exceed $330 million. Councilmember Mendes, you're recognized.
Budget and Finance Committee recommended approval, 11 favor, 0 against. With that, I would move approval.
Okay, proper motion, proper second. Any discussion? Seeing none, all those in favor say aye. Aye. Opposed, no. You adopt. Resolution RS 2020-237 by Councilmember Mendes. Resolution approving the refinancing by the Metropolitan Development and Housing Agency of 10 tax increment financing loans. Councilmember Mendes, you're recognized.
Budget and Finance Committee recommended approval, 11 in favor, 0 against, and I would move approval.
Second. All right, so I got a motion and a second. Any discussion? We're on Resolution RS 2020-237. All those in favor say aye. Aye. Opposed, no. You adopt. Resolution RS 2020-239 by Mendes, Sledge, and others. Resolution declaring surplus and authorizing the conveyance of real property to certain nonprofit organizations and authorizing grants not exceeding $5 million from the Barnes Fund for Affordable Housing to certain nonprofit organizations selected for the express purpose of constructing and rehabilitating affordable or workforce housing. Councilmember Mendes, you're recognized.
This one, there's 3 needed committee reports. Budget and Finance recommended approval, 11 favor, 0 against. And could I have the other 2 committee reports?
You certainly can. Affordable Housing, Councilmember Allen, where are you? There you are.
I'll just yell.
Okay, tell it to me, and then I'll announce it.
Affordable housing approved 8 in favor for both the amendment and the bill as amended.
Okay, Affordable Housing approved 8-0, both the bill and the amendment, correct? Okay. And then the other one should be Planning and Zoning. Councilmember Murphy, you're recognized.
We did not meet today.
Okay, so I think we can go ahead and approve anyway. So I'm back to Councilmember Mendes. You're on 2020-239.
Just going to check with Mr. Cooper real quick. I didn't think there was an amendment on this one.
Okay, so apparently there was a housekeeping to change a typo.
Give us just a second.
Sorry, I didn't have that on my list.
While we're watching, while we're checking this, I saw Councilmember Porterfield get up. I was going to scold you for moving from your seat. Okay, you're back in your chair.
Do you know the page in the package? We don't have any amendment.
If we could ask Hannah to come up, because I don't have it in my packet, I'm sorry.
Hannah, if you could come up, come to the microphone, I'll turn it on. Was there an amendment? We're looking for the amendment.
We're on 41 or 42.
This
Sorry, I
is,
just sprinted from my office.
No,
we're on 239.
239.
239.
238 is.
The,
Oh, wait a minute. So there is no amendment.
Okay.
So
Thank
that's okay. Thank you for coming up. There was no amendment with it. That's a different bill, is that right?
Yeah.
Yes.
May we-
That one's not up.
All right, so there is no amendment. So I think all committee reports are in. Councilmember Mendes, you're recognized.
Well, maybe we should cycle back and get the committee report for the correct bill.
All right, that's fine. I'm back to affordable housing. Councilmember Allen.
Apologies, the Affordable Housing Committee voted 9 in favor, 0 against.
9 in favor, 0 against, and it was with apologies. I mean, she apologized for having it wrong the first time. All right, Councilmember Mendes, you're recognized.
Move approval.
So I got a motion to approve, properly seconded. Any discussion on 239? Seeing none, all those in favor say aye. Opposed, no. You adopt. Thank you. Resolution RS 2020-240 by Councilmember Allen. Resolution extending the housing and incentive pilot program in accordance with Section 2.213.100 of the Metropolitan Code. Councilmember Allen, I guess you can borrow Councilmember Mendes's microphone, and there should be. Okay,
Thank you. I would like a committee report.
it's yours.
Is only mine. Oh, the Affordable Housing Committee approved 7 in favor, 0 against, and I would move approval.
All right, and this one doesn't have an amendment? This was okay?
No amendment.
I know there's one coming somewhere along the way. All right, so this one's clear. So Councilmember Allen has moved approval of RS 2020-240, properly seconded. Discussion, Councilmember Glover, you're recognized. There you go.
Just one very quick question. I thought a lot of the discussion tonight was on things that had to be passed tonight. What's the relevance of this having to be done tonight, please?
All right, I'm going to go to Councilmember Allen.
Thank you.
Thank you. Excellent question. This is a resolution to extend the sunset of this bill, which was March 31, and we don't meet again between now and March 31.
Okay. Thank you, Vice Mayor.
All right, you're welcome. Councilmember Henderson, thank you for cleaning the podium. All right, I was going to get mad at you for actually getting out of your chair. All right, so any questions from the back or on the sides? All right, nobody else in the queue. We've got a proper motion, RS 2020-240 by Councilmember Allen. Seeing nobody else, all those in favor say aye. Aye. Opposed, no. You adopt. We're on Resolution RS 2020-241 by Councilmember Sledge and Welsh. Resolution approving Amendment 1 to a grant contract for constructing affordable housing approved by RS 2019-1861 between the Metropolitan Government of Nashville and Davidson County, acting by and through the Metropolitan Housing Trust Fund Commission and Affordable Housing Resources. Councilmember Sledge. Okay, you're at the back. No, you don't want to come to the front? Okay, you're good. So the committee reports, let's see, it's affordable housing. Back to Councilmember Allen.
Thank you, Mr. Vice Mayor. Affordable Housing approved 9 in favor, 0 against.
Okay, 9 in favor, 0 against. Councilmember Sledge, I believe you want to make a motion to approve? Motion to approve. Motion to approve, properly seconded. Any discussion? Seeing none, all those in favor say aye. Aye. Opposed, no. You adopt. Thank you, Councilmember Sledge from the Peanut Gallery. Resolution RS 2020-242 by Councilmember Mendes and Welsh. Resolution approving amendments to 7 grant contracts for constructing affordable housing approved by RS 2018-1088 between the Metropolitan Government of Nashville and Davidson County, acting by the Metropolitan Housing Trust Fund Commission and certain nonprofit organizations. Councilmember Mendes, you're recognized.
Budget and Finance Committee recommended approval, 11 in favor, 0 against, and we need a report from Affordable Housing.
That's right. Councilmember Allen.
Thank you, Mr. Vice Mayor. But Affordable Housing approved 9 in favor, 0 against.
All right, back to you, Councilmember Mendes.
Move approval.
Got a motion to approve, properly seconded. Any discussion? Seeing none, all those in favor say aye. Aye. Opposed, no. You adopt. Resolution RS 2020-243 by Mendes and Welsh. A resolution approving amendments 2 to a subrecipient grant agreement by and between the Metropolitan Development and Housing Agency and the Metropolitan Government acting by and through the Metropolitan Department of Social Services Homeless Impact Division to cover the cost of youth homelessness demonstration program eligible planning activity. Councilmember Mendez, you're recognized.
Let's see, Budget and Finance recommended approval, 11 favor, 0 against, and need the other committee report.
All right, I'm going to Councilmember Hurt for Health and Hospitals. We're on 2022.
They didn't meet.
240, they didn't meet.
Thank you. No, the
Okay, I got
committee
it.
did not meet.
Thank you. All right. All right, so we do have one committee report in, so you can actually make your motion.
Move approval.
Got a motion to approve, properly seconded. Any discussion? Seeing none, all those in favor say aye. Aye. Opposed, no. You adopt. That took care of resolutions. So that takes care of the resolutions. Everything else has been deferred one meeting. Okay? Got it? Okay. I'm listening.
We've got two more things.
Yeah, not yet. So we have actually 3 other items that we need to get through. So we are on, let me tell you what we are. We have 3 other measures that we need to take up. Let me make sure I've got these things correct. One is what we did was we checked and made sure that if there was a particular issue that had to get passed tonight, we got it to Mr. Cooper. There are 3 other measures. One is BL 176 by Councilmember Van Rees. It is on 3rd reading. It is on page 14 of your calendar. Okay? BL 176. It's at the bottom of page 14. The other one is BL 175. It is on its 2nd reading. It's on page 8. It is by Councilmember Lee. And then we have one late bill on 1st reading by Councilmember Syracuse, wherever he is. There he is. He's back there. By Councilmember Syracuse that deals with tornado relief. So what I would like to do is, without objection, we need to take those 3 other items. Without objection, every other matter on this agenda is deferred one meeting. Everything on 1st, 2nd, and 3rd is deferred one meeting. We're taking up these 3 other items, okay? We're going to start with, just because of the nature of it, the late filed bill by Councilmember Syracuse. If you don't mind coming to that microphone. And again, there are sanitation wipes back there as well. And it's late filed. So Councilmember Syracuse, you're recognized at the back podium.
I believe I need to suspend the rules.
Right. So if you will just give me a quick explanation of what it is, and then we will determine whether we want to suspend the rules.
Thank you, Vice Mayor. As we did post-2010 flood, this is to help our neighbors and businesses who were impacted by the tornado with waiving permit fees as they continue to rebuild.
Okay. So all this is suspending the rules so we can go ahead and pass this on first consideration. Any objection to waiving the rules? Seeing none, Councilmember Syracuse.
Mr. Cooper may be able to help me out here. We have a late filed amendment, or is this actually in the packet?
It's on everyone's desk.
Okay.
So, yeah.
So
what they have is the version that will move forward.
Very good.
Okay, so that's the one we're passing tonight?
Yes.
Okay.
All right.
So there's a motion to approve on 1st reading.
Second.
Properly seconded. Any discussion? Councilmember Van Rees, you're recognized.
That was later.
Oh, okay. All right. That's okay. No problem. All right, so we have a motion and a second on this bill. It's a late file bill on tornado relief. Got it? Seeing nobody else in the queue, all those in favor say aye. Aye. Opposed, no. Bill passes on 1st reading. Thank you, Councilmember Syracuse. We are now on, let's go to the next one, BL 175 by Councilmember Lee. It is on page 8 of your agenda. BL 2020-175 by Councilmembers Lee and Mendez. An ordinance to amend Title 17 of the Metropolitan Code of Laws by changing from RS 10 to RM 9, zoning for a portion of property located at Old Franklin Road unnumbered at the southeast corner of Old Franklin Road and Cane Ridge Road. It's 38.13 acres. Councilmember Lee, you are recognized.
Thank you, sir. I would like to move a substitution, but I think I need to ask for committee reports first.
All right, we have no committee reports. but it's
Okay, I would
if we
like to
proceed.
move substitution, please.
Do a substitute.
Yes, so the substitute changes to a regulatory SP conditions. The reason it is being offered tonight, this is on 2nd reading, it'll go to committee before 3rd. It's being offered tonight because of I think the option will expire or something with the due diligence period would be jeopardized if it was deferred one meeting.
Okay. So I've got a motion to approve. It's a substitute.
Yes.
What you want to do is a motion to approve the substitute, properly
that's what I
seconded. Any discussion on the substitute? Seeing none, all those in favor of the substitute say aye. Opposed, no.
Now I'd like to
Substitute's
move
adopted. Yeah.
Now I'd like to move the bill as substituted, please.
Okay, so I got a motion on that, a proper second. We're on the bill as substituted. It's 2020-175. All those in favor say aye. Opposed, no. I'm sorry. Councilmember Murphy, you're recognized on a point of order.
I want to make sure, just for clarity, I heard Council Cooper say that it would still go to planning. I want to make sure that even though we're moving in on second, it still doesn't need a re-referral to planning? Or it just stays there?
Yeah, it'll stay there. It'll automatically be on your agenda.
I'm just concerned about us moving things through without the proper committee.
Thank you. It's a good point. We're watching it. So we were in the middle of voting. So it's a motion to approve 2020-175, the substitute bill as substituted. All those in favor say aye.
Aye.
Opposed, no. Bill as substituted is approved, 2020-175 on second reading.
Thank you, sir.
Thank you, council member. And then bills on third reading, again, we have approved everything else is, excuse me, I'll slow down. We have deferred everything else. We have deferred everything else one meeting without objection. We are on the last bill that we're going to take up tonight. That is on page 14 of your agenda. It's at the bottom. It's BL 2020-176 by Councilmember Van Rees, an ordinance to amend Title 17 of the Metropolitan Code of Laws by changing from R10 to SP zoning for the property located at 319 Williams Avenue, approximately 165 feet east of Heritage View Boulevard, 2.58 acres to permit 28 detached multifamily residential units. Councilmember Van Rees, you are recognized.
Thank you very much. I move to suspend the rules, please.
Okay, so the suspension is,
She actually doesn't need to suspend. We're just going to consider it on third.
Just want to be cool.
okay, so it's
She doesn't need to suspend. It's already on third, so.
it's already on third, but it's referred to the planning and zoning. Do we have a committee report?
Well, I guess we do need to suspend for not having a committee.
All right, so-
Committee, it's actually
May I
acting
please
as
suspend the
committee of
rules
the
in
whole.
light of the fact that the planning committee did not meet
Yeah,
and ask for the committee of the whole to suspend the rules, please?
All right, so Mr. Cooper, I'm going to check with you, make sure we've got this right. So the reason to suspend the rules is that there is no committee report,
Right, the
so we need to
committee
get that.
didn't meet today, and this is one where the funding from the lender is contingent upon it passing tonight.
All right, so do we need to suspend the rules first, and then can we act as a committee of the whole?
Yeah, you're suspending the rules to act as the committee of the whole.
And then is the vote of the committee, do we have to take a vote of the whole? We're just
No,
making
you
sure
can-
we've
it
got
can be
this
in-
right.
Once the rules are suspended, then it can be.
Then it can just be
considered.
voted on directly. All right, so do you understand what Councilmember Van Rees has asked for? She'd like to get this, there's a reason to get it passed tonight. Planning has not met. And so what the council lady is asking for is to suspend the rules because there is no committee report.
Yes, if I can make a brief comment.
I'll let you make a brief comment.
The bill, this particular bill passed on consent at planning, had no opposition in public hearing. The planning staff recommended approval. The project needs approval before March the 31st for financing secured to keep the homes at the promised affordability that was given to the community. And for that reason, I consider the matter warrants this very unusual request.
All right, so you've heard the request. It's to move to suspend the rules. Any objections to the suspension of the rules? Seeing none, you're on your bill.
Move approval.
Okay, so I got a motion to approve BL 2020-176 by Councilmember Van Rees. Proper motion, proper second. Any discussion? Seeing none, this is on Councilmember Murphy. You're recognized.
I appreciate that the councilwoman has explained the reasoning behind her suspension of the rules, but I do just want to go on the record that we need to make sure that developers, when they are filing things and that they know the process, it's not like our process, yes, right now we're going to have delays and things like that, but very often developers come before the Rules Committee and before planning and rush us through our process because of their deadlines. And so I appreciate that the council lady has explained tonight that is outside of our circumstances and why there needs to be the suspension of the rules. But I just want to make sure that we don't let that when developers come to us, they understand the timelines and that they need to use that as reasonable as possible. So
All right.
thank you, council lady, for explaining.
I think the point is well made. Councilmember Rosenberg?
Just to confirm, thank you, Mr. President, this went to public hearings at both the Planning Commission and at the council, correct? Thank you.
That is correct. Okay. All right, any other discussion? We are on BL 2020-176 for passage on third reading. Proper motion, proper second. All those in favor say aye. Opposed, no. You adopt. All right, I believe that is it. Councilmember Glover, one last point. You're recognized.
Yes, sir. And I will make this very quick because I know we're all ready to get out and go do the things that we need to be doing. You know, we obviously have a very fluid situation that's occurring throughout the country. We in Nashville have encountered really, I hate to use the wording, but the perfect storm with the tornado, now the coronavirus, and all the other aspects of it. We've got a lot of businesses that basically were shut today in Davidson County. I don't know about the rest of the state, but I would ask, if you would, Vice Mayor, that we seriously work, even if it's by telephone or however we can do that going forward, that we look at solutions, because we've got to try to figure out a way to help our small businesses stay afloat during this time. I realize Washington's looking at several things, but I think if there's anything that we can do as a city, that'd be very helpful, because if we lose those small businesses, we've lost a lot of employers. And so with that, I would just ask you to please keep that in mind, and let's see if we can come together and find a solution for that. Thank you for the indulgence.
Thank you, Councilmember Glover. We have a lot of work to do. We understand that. Remember, we do not meet for 3 weeks. We have an extra Tuesday in there. Thank you all for coming. This was very important for the city. Thank you, Councilmember Mendes, and everybody else who came. Councilmember Young, you reckon, for a point of order, you're recognized.
Thank you. Very quickly, we had an issue that I communicated with Director Cooper about this week that I thought we were resolving, but I want to make sure that this is made aware to all council members that Metro has not found a way to treat our first responders the right way in this COVID-19 outbreak. Communication that went out today from HR told our first responders that if they have to be quarantined and diagnosed, that they need to use sick time, and if they don't have sick time, they need to use admin leave. We need to put pressure on the administration and HR and make sure that if our first responders get infected, that we treat that as an IOD, injured on duty. Because we are putting them out there on the front lines of this, and they do not need to be punished using their own sick time or their own or any admin leave. So we need to make sure that as a team, we are reaching out to the administration and HR and Civil Service Commission if needed, because the communication that went out today to employees that I have a copy of is telling them to use their own sick time, and that is wrong by every means. Thank you, Mr. Mayor.
Thank you, Councilmember Young. It's my understanding that there are efforts underway
Yes,
to...
there will be a resolution for the next council meeting. The Civil Service Commission isn't meeting in the interim, and there will be since by charter they make that decision, there will be a resolution from the council asking them to do that.
All right. So I will tell you one last thing. There are issues that are going on. Obviously, everybody has to practice social distancing. This is a very difficult time for our city, but the issues remain. That's why it's important for government to continue to function and respond. Issues like that, if you will pass them along to Mr. Cooper, then we will figure out how to deal with them. Anybody else with issues, please let Mr. Cooper know. This is important. There are issues still floating from the tornado, and now with the coronavirus, it's our job, again, to step up and deal with these issues. We are part of the city government. It is our job to be responsible and help lead. I like what Dr. Schaffner said. We want to flatten that curve, and he said, let's get with the program. You all be safe, stay safe. And we'll see you back here in 3 weeks. I'll have a motion to adjourn. Adjourn, proper second. We stand adjourned.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.org.